Joining us now is Kathryn Mahoney from UNHCR. That's the UN's High Commission on Refugees. Kathryn, thanks for joining us. I want to start with COVID-19. We highlighted the impact it's having on some Venezuelans in Colombia. I assume this is a global phenomenon. What are we seeing?
Absolutely. Thanks so much for raising this important issue. The reality is, I'm calling and I'm speaking to you from New York City. So I'm here with my family and I've watched my city to struggle to kind of contain the virus, and I've watched my health system struggle. I can't even imagine what it's like to be one of the world's 80 million people forced from home, say a Rohingya refugee in Bangladesh, who's, surrounded by a million other refugees in a very, congested refugee settlement, watching this virus, devastate communities around the world when I can't even, I struggle to get access to clean water to wash my hands or my children's hands. I can't imagine what it's like to be a Syrian refugee in a city in Lebanon or Jordan where social distancing is, maybe a luxury that I don't have. So the COVID crisis is kind of a secondary crisis that is already exacerbating, the situation for people forced from home, the 80 million people forced from home right now. But what I think is really important that people are often forgetting is, this disease doesn't, discriminate against anybody, whether you're a refugee or a citizen. But what is disproportionately impacting refugee populations and displaced populations is the socioeconomic impact. And this is what you were just covering. Many refugees and people forced from home are dependent upon the informal economy. Let's say you're selling vegetables in the street. Let's say you're, a daily laborer built on a construction site. A lot of these jobs, as COVID has spread across the world, this informal economy has disappeared overnight. And how that's impacting refugees is their ability to know when and how they're going to be able to feed their families. So when we talk about the COVID crisis, we know that this is affecting everybody, but the socioeconomic impact on these populations is disproportionate.
Kathryn, I imagine there's also a global economic consequence as a result of the slowdown that's resulted from COVID-19. What's been the effect on donations from member countries, money that UNHCR relies on to support these refugees?
It's actually, it's interesting because we were bracing for us to struggle to be able to fund our operations, which are by and large largely underfunded as it is. But against the backdrop of COVID, we've actually seen an injection in our ability to seek donations, and a lot of this is coming from surprising partners in the private sector. Donations from Sony, for example, to help us. We are on the front lines of the COVID response in refugee situations around the world. My colleagues have stayed and delivered at the time when, countries were locking their borders, when flights were stopping. Our staff have stayed to make sure that they are preventing and responding around the clock as we report cases. So I can say that at least for right now, we're doing okay. I don't have a crystal ball for what next year looks like, but so far we're weathering the storm.
I want to ask you about border shutdowns, global travel largely halted. How has that impacted the movement of refugees? Many people obviously trying to flee across borders.
We at UNHCR, we've noticed that some 160 countries have closed their borders in the time of COVID. But the reality is that protecting your borders and the health of your own citizens, those are not mutually exclusive. You can protect your communities and allow people to access asylum at the same time. So we're very concerned that these laws that are changing around the world will be entrenched, and we need to stand guard to make sure that people in the future are able to access asylum as their international right. But I will remind you that even if COVID has stopped the way in which many of us are living our normal lives, COVID has not stopped wars. It has not stopped conflict, and it has not stopped persecution, the very things that are forcing people to flee in the first place.
And I imagine that you will expect these numbers will increase. We've seen some dramatic rises just over the last year.
You know, just 2 days ago, we announced that 1% of the world's population is now forced from home. And these are figures that are based on 2019. So right now, 1% of the world is forced from home. That represents 80 million people. Now, against the backdrop of COVID, the situation is complicated further. You know, people still need access to safety. People still need access from protection, or need protection from the wars that they are fleeing. And what we're seeing is that this massive, you know, in the past year, we've seen 11 million more people in need of safety. And this is due to a number of factors. But the reality is that 68% of the world's people who are forced from home right now come from 5 conflicts around the world. So against the backdrop of COVID, we are still not addressing the root causes of the conflicts that are causing people to flee in the first place. So if we were able to solve the conflicts in these 5 major refugee-producing countries, we'd be able to send 16 million people home. We need to start addressing the root causes, and we cannot be distracted by situations like COVID that are, you know, we're still able to offer people protection during these difficult times.